Life doesn't stop for back pain, and neither should you. Joining us this morning, Dr. Gregory Kuzmik, neurosurgeon at Hartford Healthcare's Ayer Neuroscience Institute. Doctor, thanks for being with us. Let's talk about this issue and what kind of unique spinal care can patients expect when they go to Hartford Healthcare?
Yeah, good morning.
Good morning.
Well, I think one of the unique aspects of our spinal program at Hartford Healthcare is really the multidisciplinary approach, where, as a spinal surgeon, I work with pain specialists, I work with physical therapists, all under the same roof. And so we can really put our heads together and collaborate to find the best treatment for each individual patient.
Doctor, it seems like it's got to be among the most delicate of surgeries, I would imagine, dealing with the spine. What are the latest surgical advancements in the area?
Yeah, the way spinal surgery has evolved is we're able to do more and more treatments with a less invasive or minimally invasive approach. So that means a faster recovery for patients, less time in the hospital, getting people back up and on their feet and back to their normal life as soon as possible.
What can patients expect when they need spinal surgery, and what does recovery look like? Is it a long process?
It's a good question. It depends on the type of surgery that needs to be performed, but with these newer, less invasive or minimally invasive techniques, the recovery does tend to be fairly quick. Many times patients can go home from the hospital the same day, and they're up and walking around right away and can get back to the normal life and normal job, usually within several days.
Doctor, at what point do you know you need spinal surgery as opposed to just back pain that you might want to think you can go to a physical therapist? At what point should you seek out a spinal surgeon like yourself?
Yeah, it's a good question. Certainly, if someone has pain that persists, that doesn't get better with some time and some rest and some over-the-counter medications, that would be a reason to see a spinal specialist. The other type of symptom to watch out for is if someone is having back pain that's associated with any neurologic symptoms. So, for example, any pain traveling down the leg, any numbness or weakness of the legs, that would be a reason to go get evaluated by a spinal specialist.
Okay, and at what point do you go to a specialist? Do people originally see their general doctor and then they refer to a specialist like yourself?
Many times, yes. Most folks start with their primary care doctor and initiate treatment with their PCP. But if the symptoms are persistent or if there are any troubling symptoms like those neurologic symptoms that we discussed, that's when oftentimes a primary care doctor will refer a patient to a specialist like myself. Or, if a patient is experiencing those types of symptoms, they can also reach out to us directly to come and see a spine specialist.
All right, doctor, appreciate it. An issue a lot of people are dealing with. Thank you for the information today.
Yep, take care.